In August of 2025, 23-year-old Iryna Zarutska was fatally stabbed while riding the light rail in Charlotte. Police arrested DeCarlos Brown Jr., a man with prior arrests and a history of schizophrenia. He had been released earlier that year on a written promise to appear in court, and a court-ordered mental evaluation that was never completed. That case led lawmakers to pass what's now known as Iryna's Law. Governor Josh Stein signed it in October.
We can and must do more to keep people safe. When I review public safety legislation that comes to my desk, I use one simple test. Does it make people safer?
Starting December 1st, certain defendants will no longer be released on just a written promise. Judges will have to set a secured bond for people with prior violent or serious charges. The law also creates a new process requiring judges to start mental health evaluations when a defendant shows clear signs of mental illness. But that part doesn't start until next year. The delay came after warnings from hospitals and county officials who said the state simply doesn't have enough treatment capacity. The shortage of hospital beds means some defendants with mental health needs are sitting in county jails for months, not because of their charges, but because there's nowhere else for them to go.
We certainly needed to figure out a way that we, as sheriffs, as detention centers, would not become warehouses for the mentally ill.
To ease that pressure, some counties are trying new approaches, bringing mental health treatment directly into local jails. In Pitt County, Sheriff Paula Dance helped launch a program called NC Rise. It's short for Restoring Individuals Safely and Effectively. Instead of waiting months for a transfer to a state hospital, inmates receive therapy, medication, and court education sessions right inside the jail.
That helps these patients with coping skills, problem-solving skills, and just preparing them for the outside world.
The RISE program actually started in Mecklenburg County and now operates in Pitt and Wake as well. In Mecklenburg, more than 60 people have gone through the program with an 80% restoration rate, most within about 50 days. At state hospitals, that same process can take triple the time. With the mental health portion of Iryna's Law taking effect next year, it gives counties time to expand programs like RISE and decide if local treatment can keep people stable while they wait for trial.
I think that this is a start to address the broken mental health system that we have across, not only in North Carolina, but across the country.
Over the next year, the state will track how these pilot programs perform. They'll be measuring restoration times, jail populations, and whether people are getting the help they need before their cases move forward. And joining me today is Representative Aaron Pare of Wake County and Representative Zach Hawkins of Durham County. Thank you both for being here.
Thank you. Happy to be here.
Representative Pare, I'll start with you. You voted for this bill. What do you hope it accomplishes?
Well, first of all, I think what happened in the Charlotte area with Iryna Zarutska was a devastating tragedy that I didn't think many people or anyone saw coming. And it really devastated all of us here in North Carolina, not just in our state, all over the country and frankly the world, because the brutality of it was very evident all over television and on the internet. And I think it woke a lot of us up to some things that we perhaps need to fix that may have, or probably would have, in my opinion, prevented this. So I think that this is a good bill. I was happy to vote for it, and I'm very happy that the governor signed it into law. And now that it is law, because it does make some important and significant changes that I think takes a more hands-on approach to public safety in the state of North Carolina, instead of what I believe that we all discovered was more of a hands-off approach to public safety.
Now, Representative Hawkins, you voted against the bill. What were some of your concerns?
First, I want to make sure that the people of North Carolina know that safety, as the governor has outlined, is the #1 concern. That is our top priority, is to make sure that no matter where they are in the state, that they feel like they can go and get back safely. And so we definitely send our prayers to that family. And as Aaron mentioned, it did shock a lot of people. And so I'm glad that the General Assembly, and in particular, and the governor, moved forward on taking a step. But when something like this happens, we can't miss the moment. We have to make sure that we're having as not a reactionary conversation, but a comprehensive conversation about all the things that can go into making sure that long-term people feel good about North Carolina as a safe place to go. And so this is a start. And that's why I voted against it, because while it's a start, it is not, it didn't fund this operation in the way that it should. And as Aaron mentioned, with pretrial detention, we didn't look at the opportunity to create statewide standards for assessing risk. That young man was very troubled, and he should have never gone to a place that was not mental health focused, and not a place that could not hold him for a long time until it could have been assessed that he was no longer a risk to himself or others. And so his ability to get back onto the streets is a larger sign that we need to make sure that we're looking at opportunity to create strong pretrial service frameworks, and so in data tracking systems that are talking to everyone across the state, so that we know who's who, and who should not be and are not ready to be in the public. And so we can go on to other things, but I think that really for me is an opportunity where I think this is a start. We sort of missed the moment in a reactionary way, and I understand that, but we have to come back together to make sure that we build a real comprehensive plan so this never happens again.
It seems a lot of the debate was whether what's laid out in this law, would it have prevented that tragedy? Do you think it would have?
Well, there's a lot of pieces to this particular story, and I think that it very well may have, and I'll explain why. I think one of the most significant parts to this law is that it addresses the mental health crisis issue with some people like Mr. Brown in this particular scenario. If you go back and look at the history of Mr. Brown, he was arrested for a slew of felonies about a decade ago, served prison time, but as recently as January of 2025, he was arrested. You know the story of when he showed up at a hospital and was having an obvious mental health crisis of some sort, where he was saying that he had a man-made material that was controlling his brain or something to that effect. Someone called the police on him. The police show up, and they sort of saw this as a medical issue. It wasn't until Mr. Brown was unhappy with that response from the police that he decided to call the 911 to speak to police officers, and he was then arrested for misuse of the 911 system. It should have been there that mental health crisis that he was experiencing was documented. So someone, a district court judge, could see that in the record and then maybe do something about it back then. This person should be referred to a mental health evaluation. Let's see if he is someone who shouldn't be in the public domain because of this. What kind of help and treatment can we give this person? Where should he be sent? Those type of questions should have been answered back in January of 2025, as recent as January of 2025. And nobody really did anything about it. That's what Iryna's law seeks to fix. There would be a requirement that this situation like we saw with Mr. Brown would have been flagged. And those people in the judicial system would have seen this and would have been required to do something about it. And if that were the case back in January, I think that maybe we would have seen history take place differently. And I think that, and that's why this particular piece of legislation is so important to be passed. In addition, in the Iryna's law that we passed, there was significant funding put to the collaboratory to study mental health, IVC, and this subject. So it's not just the infrastructure of the law that we described here that we passed to deal with what we think should be the best way to immediately address what happened in Charlotte with Iryna Zarutska, but it also takes the steps to continue studying and looking at this problem and implementing meaningful reforms down the line. As far as funding goes, I couldn't agree more. I think that additional solutions to the public safety issue is very much needed. I would highlight more support for our law enforcement, more collaboration as we do at the General Assembly with our law enforcement agencies. And that does bring into the discussion raises for recruitment and retention. And of course, all of that is part of the budget. And I think that we will get a budget. And I'm with Zach, actually. You know, the House did pass a good budget that accomplished all of these things that we're talking about. We just haven't. We would like to have had a comprehensive budget done last June in the House, but we need to sit down with the Senate still and negotiate that out. So.
Yeah, and couldn't agree more. The House, even on Medicaid rebates twice,
Yes.
but also in making sure that we put forth priorities that can meet the need have been coming. So we do look forward to our senators coming to the table. And I do want to add on that the pieces that can be studied and can be built out are hopefully will be reflected in those longer conversations over the next year, because AOC and the state psychiatric hospitals are seeing seeing waits, and what they have also asked for is telehealth models that could be implemented, clinician recruitment, making sure that they stop the backlog from the judicial process, but most importantly, data sharing. And so I think that some of that, and what Aaron mentioned related to funding, could be helpful, because the more we know about the people who are engaged in different processes that are experiencing mental health crises or involved in the judicial system at any point, we need to make sure that we have the highest level technology to share, because that's the only way to properly serve someone when they are engaged by law enforcement. And I'm sensitive to law enforcement, especially living in an urban area. They're called for everything. And we have to, and that's why it's so important that the opportunity to add on, mental health clinical professionals, these CIT programs that can either accompany or go out when it's called, so that law enforcement can be there to back up, but are not stretched. And so I think that this this conversation that was started, will make us a better state. But we have to be very, very serious about funding it, because I hear it more often than not that with everything going on, we may see more of this. And the most important thing is that it is not a partisan issue. This should not be. And so I've tried not to bring up a name of a current or former politician. It is the General Assembly, it is the House, it is the Senate, it is the governor that have to all come together to make this work, and not do it in a vacuum, but to make sure that we're listening to law enforcement, we're listening to the mental health community, we're listening to everyday citizens. Because again, when this came out, I heard quite a bit. I know you did too, from people on social media especially, because everyone had an issue about it, because they're concerned about again, feeling safe. And so that has nothing to do with partisanship at all, but everything about doing our jobs to serve citizens. And so my hope is that that we're data driven. So with the collaboratory, which again, they do a great job, that we have the ability to follow the funding recommendations that either they put out and or ones that come from the entities who serve, HHS, like those who deal with people in the mental health space and law enforcement place all the time. They know what they need, and so I hope that we're willing to put our money where our mouth is, because that's what people are looking for.
Yeah, it's an issue that impacts everyone, right?
Absolutely.
We will certainly continue to follow this story, this topic. Appreciate you both for coming on and sharing your perspective and insights. Thank you.
Thank you.
Thank you.